Last year, 77,000 women died from cervical cancer. We know for a long time now that cervical cancer is caused by chronic infection with high-risk human papilloma virus. This infection and subsequent death is completely preventable. However, in the West, they suggest pap smear every 3 years starting at 21 years of age. That would mean that the woman has to visit the gynecologist 17 times. In India, even educated women do not go for pap smear even once. So this solution would not work. What would work is if the cervical sample is collected via the urine. We know that cervical cells collect around the external os, and the first voided urine will flush these cells into the tube. So if we collect first voided urine, 25 ml of it, and centrifuge it in the laboratory, then the deposit will contain cervical cells which could be used for detection of high-risk HPV by the nucleic acid method, and if they are present, then the lady must visit the gynecologist and get the cervix treated. This will prevent progression of infection to cancer. This test should be done after the age of 30 years because at a younger age group, the lady can get rid of the infection even if it is high risk. But between the age of 30 and 45, most of the deaths will occur. So once the test is negative, for 5 years, a person can be reassured that there is not going to be any cervical cancer. So at 30, 35, 40 and 45, a lady should get the urine tested for cervical cancer.